respect to identifying it early so we can treat it and move forward, as opposed to being really deep down when someone has a challenge, I think are the things that we've been focused on as a government in total, both the political side of the House, but quite frankly, by the public service themselves, who are doing an outstanding job of focusing on their own employees and making sure they're getting the help that they need.
Thanks. With your moon landing in Chio, you don't have time to watch CPAC, so we'll forgive you.
No, I don't watch CPAC in the OR. I can tell you that. I don't know if I watch CPAC even if I wasn't in the OR. But, there you go.
Thanks. So first I want to ask you a practical question. We heard everyone say in different ways, you have to engage, you have to approach people, you have to get them help. But how do you do that respectfully, and how do you do that quickly when we have wait times and we have, everybody's busy at work? There's all these practical barriers, right? So how do you do it the right way?
Well, I remember, I go back a little way, I was in one Canada, a large corporation in Canada years ago, and I remember them saying that technology, like Blackberries and now iPhones, that was going to create more leisure time for employees, because it was going to save us a lot of time. And we all know what happened is created a stress-filled workplace where you work 24 hours a day sometimes, or you work on vacation. So it's a different workplace, it's stress-filled. And I believe, André, that there are things that we can do. Mike Schwartz had a lot of good ideas to mitigate that stress. However, there are still going to be those people who are sick, go off work and need help, and need medical help because it's a serious medical illness. So I think we have to look at it from both perspectives. Prevention in terms of providing more help for people to create less stress in the workplace, a lot of management training. But on the other hand, we need to help those people, and I think we've heard about how many people are off work with mental illness. We need to help them too, and get them very early treatment so that they can return to the workplace.
But Karen, what's the way to do it practically? You can't say, hey, are you crazy? What's wrong with you? How do you do it the right way?
There's probably a great variability among employers and how comfortable they feel asking about their employees' well-being, period, whether it's physical or psychological. But I think there are programs and services like psychological first aid for employers about how do you have those conversations. I think it's the direct way. How are you doing? I've noticed that. How are things going for you? What can we do in the workplace? What's maybe getting in the way of things going better for you? It's being able to have those conversations just directly and candidly instead of often thinking, well, I won't ask about that because maybe that goes beyond my purview.
But does it have to be your manager? Does it have to be the HR person? I know a lot of people shake with fear if the HR person comes to their desk. But who should be?
I think it probably depends on the organization and the size of the organization, but I would think someone closer to the person would be easier time to have at least that initial conversation.
I might add to this a couple of points. One is that one of the bases of the center is not just about, although it is about helping the people that become ill, it's education and awareness for the entire organization. So we've done surveys through Ipsos Reid, and we found that people will tend to go towards either a coworker or their manager before they'll go to HR when they're struggling, someone that they know or trust. And I'll give you two scenarios that we encounter that I sometimes call the tragic and the magic. So we see some long-term disability claims where the person starts to struggle, and instead of someone asking the question that Mr. Leitch referred to in her comments, they get performance managed. So then that sort of spirals down until they become extremely sick and they go off on disability, and then you've got a long uphill climb. We've also seen examples where the leader has had some training and education, or perhaps a little bit more enlightened. They don't immediately performance manage. They ask some questions. I noticed that there's a change in their behavior. I noticed that they're starting to miss deadlines or coming late. Is there something you need support on, the AP program, things like that? And that identifies early to Chris's comments, and then can get some support, can get some help, and
Kellie wanted to jump in?
Yeah, the one thing that I will say is that I think everyone has a responsibility to do this. Please don't take your title or position in the organization as a reason why you shouldn't actually reach out and help someone. You know, as Karen mentioned, when you see someone who has a broken bone, like in my business, you would never walk away from that person. You would literally run towards them in order to help them. These individuals may or may not come to you, but if you notice something, understand that all of us have a responsibility to actually act, because that's how we get help. And so I encourage you all, no matter where you are, or where you think you are in your organization, vertically or horizontally, step up, because you have a responsibility to help these people.
And I saw you, I'll just be a second, but I just want to do one more thing before I come to the question. Mike, I want to come back to you, because Karen in her comments said, essentially, there's not enough help. Insurance doesn't offer enough support for psychological service, whether it's public insurance or private. Is that fair? Should insurers be doing more?
I think there's always opportunities to do more across the entire system in Canada, supports and that, especially in the area of mental health. So that's a very large agenda that can take a long time to move forward. We've tried to sort of move forward on both that level, but also on a bit of a pragmatic approach, that there's a lot that can be done within the current supports and frameworks that exist. And so we sort of like to work on both fronts.
And Chris, I want to ask you one other thing that nobody addressed, but we often hear there's this sense that, well, mental health issues are invisible. There's a lot of fakers out there. It's an easy way to get off work. You do reviews, you hire psychiatrists. Is there a lot of faking, or is that a myth?
Well, we have heard that often. We get that all the time from companies. But our experience is that it is, for the most part, a myth. People usually, we have ways to triage cases at our company, so we can see if someone fills out one of our mental health questionnaires, we can see the people who are sick and not sick, and it's very, very hard to trick those questionnaires. We very rarely see one that is achieving the system, although that is still a common perception.
So it tends to be underreported more than anything.
I totally agree. Yeah, and I think that's the trend across Canada. Half of people with mental illness don't self-identify, and I think that transfers over to the workplace.
Good. So thank you for your patience. So fire away with the question.
Thank you. Good afternoon. I'm Stephen Hogg. I work with Pfizer Canada. It's very encouraging to hear the progress being made in terms of support in the workplace. But the workplace is not limited to a company, a department, because in Canada we have a lot of people who are self-employed. I don't have a statistic, perhaps the Deputy Minister has the statistics, but so I was wondering if there are any thoughts about how do we reach out to these people, how do we provide support for people who are self-employed. And I'm asking the question a little bit out of personal interest, because my dad was self-employed. He was actually an insurance broker who worked with Redress for 40 years, but working in his own office by himself, and he had mental health issues that led to him to take the ways of life. So what can we do for people who are self-employed?
Karen, do you want to try that one? What do you do that people tend to be more isolated if they work for themselves? What do you do to help that group?
If they're self-employed or they work within an organization that isn't doing as much as they could when it comes to mental health, there's lots of doors, and whether it's their family doctor or public, some kind of public health service, you can see a psychologist, get your own self-referral. There are doors. There are challenges getting through some of them in terms of wait times or in terms of pocketbooks, but there certainly are doors for people who don't have access to institutional programs.
It's also where your family becomes important as well, too. It's not always an employer that's going to help you out. It has family members have to reach
And
out.
I think that's a critical issue, is that when it comes to advancing mental health and well-being and treating mental illness, it is a collaborative undertaking. So it's the person living with the problem, it's families and supports, it's the workplace, it's and it's healthcare providers.
Yes, go ahead.
My name is John Marsh, and I want to speak to the question of individuals' backgrounds and privacy and the work that an individual has worked at a place for a certain amount of time, which means that the new employer has very limited information. And even when there are references, it seems that often there's almost a conspiracy of minimizing and denial, so that when an individual fairly new to a workplace does have a mental health issue arise, immediately there's a feeling of broken trust from having asked questions that really haven't been fully answered. What is the right way for individuals with mental health histories to re-enter the workforce?
So,
That would be an example where there is a fair bit of information on the center's website. It's a large topic, but it gets into, for example, many supervisors and managers are fearful in this area. They're very frightened of tripping into privacy or areas they don't or shouldn't go. So it gets into, what is the role of the manager, and it's not to be a counselor. What are the questions that they should ask? How should they deal with that? And the focus is on what does someone need to be successful at work and that kind of thing. There is information on then accommodation and how to do an effective return to work for someone who is returning from, for example, depression. There's a resource in the center called Working Through It that is videotapes of people who have suffered themselves, recovered and returned to work, providing advice to other people that are now suffering. Because one thing we found is when you're suffering, that's not the time you're reading stuff. You may be struggling to get out of bed. So there's videotape there where they are providing advice to other people that are suffering. How can they help themselves navigate return to the workplace? How can they help themselves navigate with the insurance company or some of the other players? How can they sort of be part of the process? It's not a short, simple answer. It's a complex one, but there is, again, information there on some of the techniques that can be helpful.
Karen, you want to jump in?
Yeah, I think your comment could equally be said to any other kind of chronic health condition. Someone had back pain, or someone had any other physical illness that might impact how productive they're able to be at work. Which I think is another important point worth making, is that we often treat mental illness or mental health rather as if it's categorical. You either have it or you don't. All of us have any variety of health conditions with which we continue to live and work and contribute to society. I would suggest the same is true for our mental health.
I remember doing a story about someone, and she'd returned to work after a stay in a psychiatric institution, and the same week someone came back from cancer treatment. So the cancer patient got a cake and a party, and she said, I got people who looked away. Is that changing? Is the stigma getting better? Mike, is it getting better?
I think
Or sorry, Chris. Where? I want to just mix it up.
I think it's getting better, but it's still there. I believe that people who self-identify in the workplace and with depression or so on will, I don't know what the percentage will be, but a significant percentage would not want that to be known, unfortunately. But I think things are getting better.
So we'll go to another question quickly.
My name is Steve Ackhouse. I'm with the Idea Connector. My question is with regard to Aboriginal people. We know that mental health issues are sometimes very important or very prevalent in communities. So what are you proposing to alleviate some of the problems, particularly when people don't have access to services?
So what do we do to people disenfranchised, disadvantaged, like Aboriginal people have special needs? Karen, do you want to?
Well, there certainly is a great need within certain populations. I know that, for example, the Mental Health Commission has some tele-mental health guidelines that they've been developing, which I think are going to be very important to providing service in remote communities. I think there needs to be a lot of attention to delivering culturally competent care. So, like I said, one size doesn't fit all, so that it needs to be a team in the development of specialized resource within those communities as well.
So there's different, as someone said, it's not one size fits all. So we have time for one more question. So George, thank you.
Thanks, André. My name is George Weber. I run a specialized psychiatric facility here in Eastern Ontario, a few of them. And I'm very pleased that we now have psychologically safe standards, and it's a good thing. And Karen, we do have the problem between supply and demand, supply of clinicians, and the demand is going up with more destigmatization. But in many respects, 70% of the mental illnesses manifest themselves in children and youth. And do any of the panelists have any idea where the Department of Labor, in many respects, when we're dealing with mental illness in the workplace, most of the cases have manifested themselves when people are younger, under 24. So any thoughts on how we can get departments of labor and employer groups to kind of get together and say, look, we've got to do a better job before it even gets to before people actually get into the labor force? I'd be interested in the insight or any ideas anybody has.
Minister, any thoughts?
Well, as we just mentioned, we know that 70% of these problems do occur in adolescence. We know that when those children receive care, by far the majority of them actually have productive work lives. But what I would say is that probably the people that touch and notice these children more than someone like myself as a Minister of Labor, or we are located with respect to the spectrum of someone's life, is actually in primary school education. There are individuals that these children, outside of their family, spend significant amounts of time with. And I believe that empowering teachers, individuals that work with them at school and see their behavior change, which will see massive behavior changes sometime, are probably best positioned for identifying those young people for access to services. The question that was raised before is, with respect to each provincial jurisdiction, what is the access to those services? That's not my position with respect for me to comment on as a Minister of Labor federally, nor, quite frankly, do I think it's actually the purview of my provincial Labor Minister colleagues. Children are a very special body, you're right. They are probably the most cherished in society, and every one of us that deals with a child, either at a YMCA or a not-for-profit organization, when you see them on the soccer field or you see them at school, have an opportunity to intervene. And so whether you're a volunteer that works with kids, which I've advocated in the past through a report that I published in 2007 called Reaching for the Top, or whether you're a school teacher, I encourage you to step up to the plate. This is a collective responsibility. It's not something that should be placed as a burden on single members of society. Every single one of us, whether it's myself, the people on this panel, each one of you in this room, I'm sure you're all involved in not-for-profit organizations that impact kids, or you have children of your own. You have a responsibility, if you see a challenge or problem, to identify it either to their parent or identify to the child directly so that it can be addressed, because that's the most impactful way you can help them. As I say, we know that the majority of these children, if diagnosed before the age of 18, they actually have a productive work life.
And Chris, you want to jump in there?
Well, I would just say, I was an advisor to the workplace, or to the Economic Roundtable on mental health, on children's mental health. And I would just say, and this is a fact, pediatric psychiatry is a subspecialty of psychiatry. So all psychiatrists can't do that. I heard anecdotally a few years ago, and I don't know if this is factually correct, but I'll just share it with you, as a psychiatrist who told me that a few years ago, the number of people who had graduated from medical school in the field of pediatric psychiatry was something like 12 across the country. So it's a big problem. I don't know the solution. There's a shortage of psychiatrists, and therefore there's wait times of 6 months to a year for children who have mental illness, children and adolescents. So what do you do about it if there's a shortage of specialists? I don't know, but I think it's something that needs much further discussion and dialogue.
And once we start on kids, Karen's going to get
I have to say, well, the psychiatrists are company. They are not the only specialized mental health care providers in the country. Your article you reported on, André, when Senator Kirby called for, we're going to do something in terms of the biggest return on investment in children and youth, and invest in children and youth. That would be a place to start if we covered a certain basket of services for children to get prompt and adequate care. And it relates to the point that I made earlier, which is that as public institutions like schools, who at one time had more school psychologists, have less, we can count with them.
And we know things like CBT, cognitive behavior therapy, works well in children.
I think we did see still also, one of the reasons we focused on the workplace is it's a terrific channel to deliver information and education. So if you are educating your employees in the workplace and enlightening them about stigma and some of the barriers that go on here, you know, there's a colleague of mine that went through a stretch where a teenage child attempted suicide. But if you can educate the parents on these illnesses, the nature of them, and reduce the stigma, if nothing else, then they are better equipped to, again, seek the support they need and to recognize the signs and to take action earlier. So there's many supports that are still needed in this area more, but if there's two things that an employer can do and not go far wrong, it's to help reduce stigma, I think, across the whole population, and increase education and training.
I'll just add one quick point, and that is, I think there's a real opportunity with this generation. I have a 16-year-old daughter, and she has been educated on mental health and knows everything about it and has very little stigma about it. So maybe in the next generation, there's a huge opportunity there to improve. Great.
And that's an excellent positive note too. I know there's an appetite for more, but we're out of time. So join me in thanking Kellie, Leitch, Cohen, Chris Anderson, and Mike Schwartz for a wonderful time.
Economic Hub, I would like to thank our expert panel for taking the time to speak with us today. We certainly do need to stop the stigma, and it starts with discussions such as these. I'd like to thank our annual corporate sponsors who, of course, make events like this possible. A thank you to all of you for attending, and I also want to draw your attention very fast to the launch of the club's Cross Canada Tour in partnership with the Mental Health Commission of Canada and Medaca, occurring this Friday in Toronto. So please visit our website for more details. Once again, thank you so very much for taking the time to discuss such an important topic. Let's continue the discussion over lunch. Have a wonderful day. Cheers.